all of our warriors out there, and thank you for joining the Scleroderma Foundation of California for our second episode in 2026 of our Sclero-Sun podcast. My name is Tina Berger, and I'm the Patient Services Director with the Foundation, and with me is the amazing Alejandra Serrano, our patient support for the Foundation. Today, the Foundation sits down with Jamie Nicole, founder of the AIP BIPOC Network, that centers BIPOC voices in autoimmune and chronic illness care and transforms research and lived experience into culturally relevant, practical tools that support healing in everyday life. She brings her own experience as a patient, coach, and advocate to guide the organization's mission towards equity, prevention, and inclusion, helping communities access care that feels personal, informed, and possible. So we are so happy to have you here today, Jamie, and we want to thank you for joining us. And if you can tell us, first I thought that I would like you to just tell everybody, what does AIP BIPOC Network stand for?
Absolutely. It is originally started out as AIP, what we know as the autoimmune protocol.
Yes.
But it has since evolved into something much more. But before I go into what that much more is, the BIPOC is Black, Indigenous, and People of Color, which just emphasizing that certain populations face more hurdles and issues regarding equity than others. And so it centers those first with the B and the I. But over time, we have a dual framework now where the AIP also stands for access, inclusion, and prevention.
It's perfect. I like both of them very much. And why I felt this was so important, I want people to know how I kind of met you, which was scrolling through my LinkedIn, and it was suggesting you as a connection. And then when I clicked on that connection, I started reading about you, and I was amazed on some of the work that you've done. And then I saw a little bit about your summit, and then I said, I got to go to her website. So I went to your website and I started looking at it, and I thought, wow, she covers so many areas that we don't. And there are areas that we want to make sure that we are letting our families know about, because what you do is amazing. So that's when I sent a message through your website. I didn't know if I would hear from you, and I did. And you and I met and talked on Zoom, and I got to know a little bit more about you, a lot more about you and the incredible work that you're doing, which led to me thinking this would be really important to have this this opportunity to bring you in today and let other people know about the amazing work that you're doing. So I can't tell you how much I appreciate your time, especially after your busy weekend. And I would love for you to just kind of talk about, share a little bit about yourself, where you're from, what life was like before the AIP BIPOC Network, and when this AIP BIPOC Network was founded, and what led you to forming this nonprofit.
Okay, absolutely. But before I do that, I just also want to clarify, because I gave what the acronyms meant without giving a little more detail, because it kind of is the basis of the conversation today. So the autoimmune protocol is more of what we focus on as at an individual level.
Yes.
What are you eating? Your stress, your movement, your sleep. But when I started doing that, I noticed that there were a lot of other barriers, and that we needed to expand what we do as an organization, so that access, inclusion, and prevention is our structural framework. We look at barriers in healthcare, policy, research, not only research participation, who is included in those studies, community resources, and we work to change those systems so people can actually get the care that they need. But on the secondary level, the individual level with the autoimmune protocol, this is a nutrition and lifestyle approach that helps some people reduce inflammation and their symptoms. So we don't treat it as a cure or as a requirement. It's one tool amongst many things. And I'm a certified autoimmune protocol coach, which is how all of this got started in the first place. And so our focus is on empowerment and helping people make informed decisions about their health. So I just wanted to preface that because you did ask about what the AIP stood for and what they mean. And so I wanted to share a little bit more about our AIP framework. Now, how all of this started. This is not my background. I just started out as a patient myself. A little bit about my story, and I'll try to make a long story short. I was a single mom with two kids, just finished college, was working a six-figure job. And honestly, how all of this started, and I found out I had autoimmune disease in the first place because I had heard nothing about it, was I was just trying to lose weight. That's all. That's all I was doing. And I was following someone on the line who said, if you're doing everything right, if you're eating right, you're working out, and you're still not losing weight, you need to go to the doctor and get these things checked. One of those things checked was your hormones. The other was your gut. So me being a type A personality, that's exactly what I did. I had no clue that the symptoms I was having, aside from not being able to lose the weight, were related to any type of autoimmune disease at all. So when I went to the doctor, I told her my findings. I came up with my binder, again, type A personality. And long story short, I was diagnosed in 2015 with my first autoimmune disease, Hashimoto's thyroiditis, which impacts my thyroid, which impacts me, the ability for me to lose weight. Lo and behold, I started doing more research, implementing things, taking the medication, implementing holistic practices, lost some weight, thought I was doing good for a while, but went back into my old lifestyle. I wasn't focusing on stress. I wasn't focusing on sleep. I was focused on climbing the corporate ladder, which is what they tell us to do. But then the fatigue. The fatigue continued even though other symptoms improved and I lost a little weight. So long story short, after 4 years of trying to figure out what that was, I went through an Epstein-Barr flare, had Epstein-Barr in high school, which we know now. A lot of people believe that that triggers autoimmune disease.
Yes.
Uterine fibroid embolization, I thought that was it. My vitamin D, I went through checking everything. And long story short, 4 years after my first diagnosis, I was diagnosed with narcolepsy type 2. The interesting thing about that is that the Autoimmune Association and people who have studied this believe that type 1 is related to autoimmune disease, where your immune system is attacking the chemical in your brain that's regulating your sleep cycle. But the majority of the people I know with an official quote unquote autoimmune disease have narcolepsy type 2 like me.
Interesting. And can I interrupt really quick to tell you that I came across a very informative article from SRF about research and the importance of research that led into a whole nother conversation about Epstein-Barr virus and that key to different autoimmune diseases and the triggers with it. So it was very interesting. So as you bring that up, I also found that very interesting.
Yep, I had Epstein-Barr in ninth grade, but I didn't know it was like, you see those commercials about, chicken pox and shingles. I didn't know that you can have, a reaction or, later on in life. So I had no clue. So in the process of my doctor trying to figure out why I was so fatigued, that was one of the things that she checked. And I had to be put on antivirals, take off work for a while for that too. And again, just trying to figure out what was going on, but I had all of these things going on at the same time and had to go through the process of elimination. Then I'm going to go ahead and then jump back in the story. So then again, 4 years later in 2023, both of my shoulders go out. I had already had knee surgery in 2019. All these are long story short. Long story short, I end up getting diagnosed with rheumatoid arthritis in 2023. But before then, I'm not sure if you have heard stories like this. Like you don't know how sick you are until you get better, especially if it's been for a long time. And afterwards, a lot of the symptoms that I was having as a child, but didn't put two and two together. So it became my norm. So after that first diagnosis and I got on medication and I started doing research and feeling better, I'm like, oh, it's almost like when you get glasses for the first time, like you can't see, but you don't know how bad your vision is until you get glasses. Something like when the people who have color blindness and they get those glasses where they can see color. And I'm like, oh, that's how it's supposed to look. I was
Absolutely.
like, oh,
Yeah,
that's how
we see
I'm
this a
supposed to
lot.
feel.
They
right?
can scleroderma patients can definitely identify that they get sort of used to not feeling well and pushing forward and not realizing that it's not normal, but the disease, the fatigue caused by the different vagaries of the condition make that very hard, and not until they start feeling better or get on medication or learn more about the disease do they realize that this isn't the way that they should be feeling. They just push forward
Absolutely.
their new normal, not realizing that it could be better.
Yeah, and in retrospect, to your point, I've oftentimes thought that no one is to blame for it. Your immune system is immune system, but had I known and taken better care of myself and not pushed through because I'm thinking that that's normal and everybody is experiencing the same thing and it's just something that I had to do, I probably could have been able to better control my symptoms. But I was again at work, what we're supposed to do is high stress job, little or no sleep, or exhausted during the day trying to make up for my work at night because I wasn't able to do it during the day because I was so exhausted, right? But after that first diagnosis, I was like, well, does everybody know about autoimmune disease and the impact and that they can feel better if they go to the doctor and advocate for themselves? So it was at that time because really didn't like my job. Like I was appreciative of it, but I knew it wasn't my passion. I was working for the government. I used to tell people I would work for Treasury, but I was working for the IRS, large and mid-sized business, corporate, places where they report you to the president if you're not doing your job right. So I couldn't fall asleep. It was a risk of me losing my job. So that was added stress on
I
me
can
as
only
well.
imagine.
And so I became a certified health coach in 2016, 2017. So jumping ahead, again, still trying to find out and figure out what's going on with me because I'm still exhausted after my 2015 diagnosis. Going through the surgeries with the fibroids, finding out about the Epstein-Barr. Now we're into, and also the narcolepsy. So now we're into 2020, 2021. We're in quarantine. We're at the house. I'm still having a lot of trouble because the exhaustion, there's one thing to have autoimmune fatigue, but the narcolepsy fatigue acts totally different. I could not drive. I would fall asleep at ATMs. I would fall asleep at my job. I was out at large Fortune 100 sites where it's glass windows, auditors next door, the CEO in front of me, trying not to fall asleep. Trying to figure out as a single mom, how do I get home and beat traffic because I can't sit in traffic. I had that worry, but then also too, I had one of the most boring jobs in the world, reading contracts and reading code. So long story short, on quarantine, I decided to try to learn more for me. So that is why I became a certified autoimmune protocol coach. I was on the medications, getting certain things regulated, but I was still having issues with the medications that they gave me because we all know about step therapy. They put you on the medication that you want, not necessarily the medication that's best for you. So I wanted to find other ways to help myself and also take back some control. A lot of times with autoimmune disease, the mental part comes from this disease is taking away all of my control over my body. So any way that I can get back some control of over my health, I know it's chronic, but any power I can take back, that's what I was trying to do. I was able to get a scholarship from Autoimmune Wellness and the Autoimmune Certified Coach Program. They had a BIPOC. I'm going to tie it together. They had a BIPOC scholarship. And so that's what I got to take that training. I believe it was in 2021. Whenever COVID was, that's when I believe I took the training. So long story short, as a part of that, there's an organization connected to autoimmune wellness and the autoimmune certified coach called the AIP Summit online. They have a summit every January with all the coaches. The following year, I believe it was 2022. Actually, I know it was 2022. I was not only a part of that summit and did a presentation, I believe it was on sleep, but she had a BIPOC roundtable where I was able to hear voices of other people of color in their experiences with dealing with either diagnosis, navigating the system, doctor's appointments with autoimmune disease as a person of color. Now, as a Black person, we don't live in a monolith, or as people of color, we don't live in a monolith. It was my opportunity to see the experience through a different lens. Sometimes we only see things through the lens of our own perspective. But when you see, oh, the Asian woman with autoimmune disease who's also a nurse went to the doctor and they didn't want to test for a specific disease because they said those in the Asian community don't get that disease, but she had all of the symptoms and they ignored her. And so that led to a delayed diagnosis. That led to more of the disease impacting her life, not only physically but mentally. And in some cases, if you have to lose your job, take off work financially, then that's an issue. Those conversations were so powerful. I didn't want to, because I believe by the time it rolled around to 2022, both of my kids were out of the house. I had finally found the right medication for my narcolepsy, and I'm also a fitness instructor. They have these programs where you can go to a resort and teach twice a day, and I was going to do that because all of my life I had been sick.
Yeah.
I thought the symptoms were normal, but when I was going through it and I was really depressed, trying to figure out what was wrong with me, I was like, okay, God, anything you can do to get me through this, I'm willing to do. And so after that roundtable, I kept hearing a voice saying, you need to continue that conversation. You need to continue that conversation. And I did not want to. I wanted to drink my water and mind my business. And that's all I wanted to do. And so I reached out to Jamie Hartman and asked if the conversation was continuing. She was continuing the summit, but it was only conversations on food, on stress, on sleep. But what about these stories? I need these stories to be told because other people who look like me have no clue because we're operating in silos. When you go to the doctor and they tell you you're crazy and refer you to a psychiatrist instead of actually helping you, who do you know if you don't know anything about autoimmune disease and how it operates and how it works? And so she said to me, no, there's nobody doing it, because I was just going to help. I was like, I'll just help. There's nobody doing it. But if you want to, you can. I'll give you my platform. I think at the time she had over 10,000 people on her email list. And you can start. And so that's how the roundtable started and how my patient story turned into me doing advocacy and starting those roundtables in 2022. But even then, we had no plan of, or I had no plan of starting a nonprofit. But the conversation, even on that first roundtable, was so powerful. And we saw that there was a need and that there was a gap that needed to be filled, that the following year, after we started our online community, I did some more education myself on underserved, under-resourced communities. We decided that we had no choice but to start a nonprofit, start the nonprofit based on all of the things that we were doing already and things that we wanted to continue to do in the future.
Wow, that's amazing. Everything that you said, because you could have just left it where it was, but you saw a need and you felt that it was really important to do more than just learn about the protocol, because we all know that nutrition is really important and learning more about it. And in talking to you, I learned a lot more about the autoimmune protocol, but even the practicality that you've brought to it, that because not everybody wants to follow these protocols verbatim. And I think that the common sense and practicality that you bring to it, not very many people do. And which is a whole nother conversation, but a very important one. And so for you to say, I see this need, and I remember when I looked at your website and I saw this poster at one of your events that has a woman that looks just beat down in the picture with little comments all around her. Could you, I don't know the exact words, could you possibly be dealing with an autoimmune disease? Are your symptoms a part of an autoimmune disease? And it had little questions about fatigue, muscle weakness, joint pain, and it was all around. And that resonated with me when I saw that. And I think sometimes you have so many people that don't know how to speak for themselves. And I've been in this field, I told you, for a very long time, since 1990. And I'm still meeting people that are misdiagnosed, undiagnosed, not on the right treatment, feel defeated, lose hope, gaslighted, disrespected. And, just like the woman that you talked about that they wouldn't do the right testing on. So you knew there was more that needed to be done, and you did it. And you added something. So I applaud that you're trying to help people find ways to learn more about, diet and nutrition, and the practicality that comes along with it, because it can also be very expensive sometimes to learn some of the ways to have that. But then you also empowered people of color to learn more about it and have a voice for themselves.
And absolutely, that was part of the issue that I had starting out, because sometimes when you're ingrained in it with autoimmune disease, you think that everybody is aware, right? After you learn about it, it's just like so we had to step back a little bit, and it was even mentioned this weekend at the summit. I partner with another rare autoimmune disease organization, myasthenia gravis, right? So you're talking about scleroderma, myasthenia gravis. People didn't understand that lupus, even though they know what lupus is an autoimmune disease. MS, they know what it is. They don't know it's an autoimmune disease. Even with rheumatoid arthritis, a lot of people have heard about arthritis. They don't know the difference between rheumatoid arthritis and osteoarthritis. So when you talk about advocacy or trying to get out into the community, I have to explain, okay, let's back up a little bit. You may not know the terminology. And I know it's even more harder for rare autoimmune diseases like yours. No one's going to go into their doctor's office and say, I think I have myasthenia gravis. I think I have scleroderma. No one's going to do that, but they do know and go into their doctor's office with these symptoms, the symptoms that were on that poster. So if I can give them the words or the tools or the information to give the doctor, again, a little more information, because the first line of defense is their primary care physician, who probably didn't study autoimmune disease at all. So we have to go out into the community and teach them to be their own advocates. What is your family history? Do you have a history of autoimmune disease? Do you know that's an autoimmune disease? Does your doctor have that as a screening question? They have on most screenings, does your mother have cancer? They have the wider diabetes, the common diseases. 9 times out of 10, they don't have an autoimmune disease on there. But if you know that you do, write that in there, because that's one more clue. That's maybe an additional test. That's maybe an additional referral that they can give you to help you get one step closer to finding the answer faster than you would have if you did not know that information.
Yeah, I like that you said that, because in the scleroderma community, we came up with a CME program for doctors that's an early detection in scleroderma, because we're still meeting so many people that end up in crisis. And this wouldn't have happened if they were empowered, because unfortunately many doctors don't know enough about scleroderma, even rheumatologists. You need to be a rheumatologist with a specialty in scleroderma. So empowering our families to understand that, but also trying to help the doctors learn more about it, so they can maybe not unnecessarily suffer as a result of their doctors not knowing. So I see you doing the same thing. And while you're doing that, teaching people that a lot of these autoimmune diseases come with overlaps. And Absolutely. Those overlaps, you might not know that even has anything to do with it until you're educated on it. So I applaud that. That's wonderful. Wow, I love it. And I told Alejandra, I know that we'll take that whole hour, because it's really important that everybody understands all these things. And Jamie, many times people have come to us asking for certain things, and while we're here to provide patient support, outreach, and education and advocacy, there are certain areas that we don't feel that that we're as strong as we would like to be, and that's why I say collaboration and partnerships are so important, because together you might have this one area that you're really proficient in, and we might have one, and together we're going to give this person the best opportunity to live long term with a chronic illness. So I think it's beautiful.
Absolutely.
So this kind of gives me this outline, and I saw this on your website about the groundwork. You started in 2022, and then it's sort of I can't think of the right word, expanded into what it is today. Is there any more that you want to talk about the groundwork and where you are today before we go on to the next question?
The groundwork was really based on building community. After that first roundtable, which I mentioned the AIP Certified Coach Program in autoimmune wellness, that was part of it too. I felt a little guilty. Um, I say this with the utmost respect. Um, there was a lot going on during that time, and I didn't. And I was following a lot of people online in the healthcare space. I saw a lot of vitriol online, people of color. Um, One of the ones that spawned also this is there was a lady that I was following who had a basket full of food from Whole Foods. And basically, she was saying that the reason that people of color are getting sick is because they choose to not eat well. And so, me as a person at the time, at my job, I was making six figures, but I'm also a person that back in the day when I was married, divorced, in college with two kids, was on WIC and food stamps
Yeah.
and still try to do my best. I've been on both ends of the socioeconomic spectrum, and I know that eating unhealthy is not necessarily a choice. There's all these other things. There's the non-medical drivers, as they call them now, but the social determinants of health, right? Those non-medical factors that prevent people from getting correct care. So that was also a driver of the roundtables. And then also with that, I mentioned that, Mickey and Angie from Autoimmune Wellness, along with Dr. Sarah Ballantyne, were providing that scholarship, but they were also doing the work. While I saw some non-people of color with vitriol, these people were out marching for George Floyd. They were putting their money where their mouth was, in spite of the impact on their business, by giving scholarships, by extending their platforms to people of color to share their work. Because there's other, autoimmune coaches who do certain things within their culture, gave them their platform. And so I'm like, okay, Jamie, if they can do it, even though I just wanted to sit at home and drink my water because I had gone through hell just trying to figure out what was wrong with me, then you need to do something because I had, with that six-figure job, access. I had good government insurance, but I was also on the board of a federally qualified health center who saw under-resourced communities, and I cannot imagine what it would be like if I didn't have the resources that I had. I went through hell sometimes, isolated alone, trying to figure things out. But I also had time to take off or work for an hour to sit on the phone with a doctor or a pharmacist. There's a lot of people out there, especially people with frontline jobs, who cannot do that,
Agree.
right?
Yes.
So that's the gap that we aim to fill when you talk about foundation. Had this organization or something like this organization that took a bottom up, top down, individual system level approach been out there, this organization would not exist. There's all sorts of organizations led by people of color, right? Because again, we're not a monolith. There are people who have autoimmune disease who are on a spectrum. Some of them have retreat money to go fly out to a different city to go to a retreat to learn about their autoimmune disease, right? They can find community that way. The people that we're reaching, the reason why our summit and our expo are in what we called, what the city considers under-resourced communities is because it's in walking distance. I can collect all of the resources, whether it be cholesterol checks, blood pressure checks, blood sugar checks, mobile health units, organizations that provide information on housing, information on food, information on jobs in one location, and anybody in the community can walk to it. I wasn't seeing that. So the
Love
part
that.
of the spectrum that the people were leaving out, the people who may not have access to internet because people don't think that people have that some people think that we still don't have what do you call it, technology deserts. I just spoke to someone the other day who's called because she needed help with her husband's insulin. He's getting his legs amputated. She has disease. They don't have a computer or internet access at home. They can't even access telehealth properly. Who's helping those people? So that's what our foundation is built on, and how we want to serve the community, who oftentimes get left behind when we talk about access.
Yes, and can I say that I think that everybody's well intended when they put organizations together and do a beautiful job. but nothing compares to having your own lived experience, like you said, having a background on both sides of the fence, that you went through certain things while you were growing up that allowed you to see it from a different perspective. And sometimes it takes that experience even for people to be humble to understand that. So while everybody means well, going through certain things in our life that other people haven't been able to experience, it does make that difference, and that's what makes you different, and your organization.
Absolutely.
Because you can address those things, and you know that they're out there. You're not just thinking they're out there. You see it for yourself, and you're in the, and what do you call it, the trench of these also underserved communities, and you're seeing for yourself firsthand the importance of this, and you're empowering them. So I think it's
Absolutely.
beautiful.
And I always joke around. I don't know why I ever kept it because I'm in Texas, so my loans this doesn't work, so you can't take the number. But this is back from maybe 2022. No, what year are we in? No, 2002.
Okay. Wow.
I keep this in my drawer as a reminder of how far I have come, and also a reminder of the people that I'm trying to reach and
So
serve.
tell
Because
me what that
it could
is.
be
What is
anybody
that?
at any time, any day, right? And also to just want to add on to it because it is prevalent now, especially with all of the layoffs. You never know when it could be you.
Yes.
Right. I didn't know. I ended up having to get medical retirement. I couldn't do my job anymore. So even though I had a six-figure job, now I have six-figure bills, but I don't have a six-figure income. So now people who were on the other end of the socioeconomic spectrum have to figure out how to make their dollars stretch. So when you talk about roundtables, you mentioned some of the topics from the roundtables. We've had CEOs from health centers. I had no idea. They're not free clinics, but they have a sliding scale. And if you have to go to the doctor, they have also linkages of care. They have mobile units to go to your home. So there's all types of resources out there that people don't know about. Sometimes it's not about just only making the medication cheaper. It's about making other things more accessible, other things more affordable that are not necessarily quote unquote medically related, but those social determinants of health that I mentioned earlier, those other barriers to health that we need to address as well.
Absolutely, and well said. But what is that card? I don't know what that card
Oh,
is.
yeah.
No. Uh-uh.
It's different in Texas. So this is a food stamp card that I had way back in the
Okay.
day. I was mentioning that I've
Okay.
been on the other end. So when I
Ah,
was in school and at the University of Texas, I had my master's in accounting. I was married and divorced with two kids. So at some point in time, I was working.
yes.
I was in school, but I needed assistance at the time to get me through until I got my degree, which also brings me to this because it's prevalent now. With the new rollout, I was having a conversation with some partners that I have here in Houston of now those new requirements for SNAP benefits that the government just rolled out. That's going to impact a lot of people, especially the work requirements. So we're trying to figure out what we can do because I believe there is a volunteer requirement where you can volunteer if you're a certified nonprofit organization, but that's going to impact a lot of people as well.
Yeah, people that have chronic illness might have that difficult time with some of that community service. I understand. So
Well,
maybe
not
learning a
just
little
community
bit more.
service, it's a work requirement, but right, they're trying to be so slick sometimes. But you think about if I'm working 80 hours and I'm getting paid depending on what I'm being paid, is that going to take me out of the bracket to where I qualify for food assistance in the first place?
We
So
hear
I
that
can
all the
work, but I
time.
can't work too much or
Yes.
make too much because that's going to qualify me from getting that SNAP assistance. And then if I have a flare and have to go into the hospital and can't work, am I going to be able to get that back on the assistance? But then there's the paperwork requirements that they have now. If I miss something with that, so now we're trying to galvanize and say, okay, what can we do to educate the population, chronic illness population, senior population, of all these barriers we now have? Because again, the government thinks that we're a monolith and we're not. One week you may be able to work and one week you may not be able to work.
Correct.
How do we
Yeah.
navigate that now?
Right, right. And we know that in some cases, you've got wonderful bosses that are very understanding, and in others, there is no compassion whatsoever, and people are holding on by a thread because they can't afford to lose their jobs. So I
Absolutely.
fully understand what you're saying, and I, again, commend those efforts. Like I said, there's so much to what you do, and I think that it's important that everybody knows that. So you mentioned, and I really think it's important, when I was scrolling through your website, I came across your AIP BIPOC Roundtable, and I was so impressed over your speakers and your content. Can you talk a little bit about your roundtables?
Absolutely. We try to have various topics on everything, as you mentioned, from environmental impacts that people don't know that much about and provide resources to health centers and the resources that they provide. It could be anything from the individual level, from autoimmune protocol, trying to debunk the misconceptions that are out there and give people the correct information. But we try to do it from a lens of equity, a lens of access, inclusion, and prevention, because you can talk about all of these things in theory, but if they're not applicable, then what's the point? So if we're going to talk about food, we need to talk about, okay, access to food, food deserts, how that may apply. What are the resources that you can turn to in your city, your county, in a rural area if you don't have access to certain things? So we talk about the same things that most people in this space talk about, but from a different lens and from a different perspective. And then we also try to follow up and provide those resources in a hub for them as well. So we have an online hub and the Mighty Network, which is another one of our programs, where they can go and find all of the information in the resource libraries that we have. We're in the process of putting more information into those libraries and online. But it's a wonderful opportunity not only to learn more, but if you are new or newly diagnosed or not diagnosed but have the symptoms, it gives you access to a community that understands, and that you can tap into as well. Again, this is how the entire organization started. I think, again, it's important for us to see people who look like us.
Yes.
Because for a long time, especially when everything went online, I talk about, how all of this got started. We've seen people online. I was seeing summits, but I didn't see anybody who looked like me. And I'm not like even talking about Black people. I'm looking online and I'm like, well, they couldn't find one proof. There's not one person of color. They could have gotten him, right? And so when you talk about a community of people who don't necessarily know what autoimmune disease is, don't know what scleroderma is, they don't know what lupus is, and you have people online who are trying to tell them, they may not think it applies to them. That's not, so sometimes when people look, that's not diabetes, yeah, type 2. High cholesterol, maybe that. But I didn't even think when my doctor told me that I might have narcolepsy, that I thought she was crazy. I didn't go and get my test done for a while. That's how, because I didn't know, right? I had never met anybody in my family that had narcolepsy. The things that I saw on TV weren't how narcolepsy presented in me because they sensationalize it for movies, so it looks different. I don't
Very,
just pass
very.
out, right? So if
Funny
you
as you
don't know
said
what the
that, I
symptoms,
pictured it.
yeah, it's not how I picked. No, this is narcolepsy. I was a little sleepy before this podcast. I was like, Jamie, pull it together. Make sure I didn't eat lunch because that makes it worse sometimes. But if they don't know, they don't know. But when you see a person of color who looks like you'll pay a little more attention. And be like, oh, well, maybe that's something I should look into. Oh, maybe the problems that my grandmother and my mother were having with their knees wasn't just osteoarthritis. Maybe it was rheumatoid arthritis because their fingers were disformed, and I didn't know that. Maybe now I can take that information to my doctor. Now I heard that I was online. There was a lady who was talking about symptoms like mine. I asked my family, it runs in my family. Now you have justification because they need that for insurance to get tested for that, right?
Sure.
So it's all about putting people with the knowledge in front of people who need that information, who look like them, and that is hard to find.
Yes, and while I was looking at your roundtables, and going and looking at the professional backgrounds of your speakers with all different types of diversity, and then and what they were talking about. The one that resonated, because I've had people even comment on some of our posts or at meetings saying, I wish that there was more being done to look at the environmental triggers of autoimmune or chronic illness. And you had, I think, more than one discussions about that with some of the experts out there. Are these recorded? And are these things that people can go back and watch in these discussions in your roundtables?
So right now, how we have them set up is because we partner with autoimmune, the AIP Summit. My bad, the AIP Summit. They're only available for 30 days, but I have the recordings, and so when I mentioned earlier, I'm in the process of
Okay.
building a library, being respectful of how she has her model as well. We're going back and putting those resources up, but the resources that they provide on the summit are up all the time in our online community on the Mighty Network.
Okay, that's good to know, because, for instance, we put together an education library on our website, and we tried to break it down into different areas. And it's definitely important that people can, go on and see these areas and educate themselves. So I'm really glad to hear that. Can you also elaborate a little bit on other discussions at your roundtable that are pertinent, that would resonate with some of our audience?
One of the ones, just because I think we mentioned the autoimmune protocol, and I believe we discussed it a little bit as well. Um, so there's the autoimmune protocol who is how can I explain this in a simple way? Because I know we're short on time. It's been around for a while. It's an elimination diet where you take all of these inflammatory foods out of your diet. The next step is reintroduction. You slowly add them back in to see what your triggers are. Because the hard part with autoimmune disease is that every autoimmune disease is different. Every person is different. What we have found is that a lot of people are not doing reintroductions properly. They're getting stressed over it. They think it's a
Sure.
long-term thing when it's just a tool. One of the most prevalent conversations that we have had, it was the last one that was on there, who is an advocate for us, a sponsor for us, is by Dr. Sarah Ballantyne, when she talks about Nutrivore. So if you never heard about Nutrivore, a nutrient density is one of the core concepts of AIP, because it's not just important what you take out, it's important what you put back into your body. And what she was finding is that people weren't doing the reintroductions properly. Those foods, also though they could be inflammatory, they're not inflammatory for everybody. So if you're leaving out entire food groups, you're positioning yourself to get other diseases, because diseases don't just happen because of what you put in your body. It's because, I mean, what you take out, right? They always say processed foods. But if you don't put what your body needs into your body, those healthy foods, then you're going to have a problem as well. What I like about Nutrivore and how it interacts not only with AIP, but any diet, it's not an autoimmune specific concept, is that in her book, she talks about the social determinants of health. In her book and in her writing, she talks about food deserts. In her book and in her writing, she debunks the myth that if you don't eat organic, you're not doing it right. Well, I'm in the hood. All I have is a Dollar General. Our Dollar General up the street has produce in it. Better, best, and good. I may have that wrong, but good, better, best,
Sure.
right? If I go to the store and all they have is canned green beans, and a hot dog with chili cheese on it. Or, they have certain things there, but I'm thinking, oh, it's in a can, it has high sodium. Well, yeah, but it still has more nutrients in it than the hot dog. Rinse them off. They don't have to be organic. There's benefits in frozen, there's benefits in canned. You can work with what you have. Now, if you can afford in this economy to go to
Sure.
Whole Foods and
Sure.
get organic,
That's the
we're not
practicality that we
knocking
talked
you
about.
either,
Yeah.
but we're trying to say it doesn't have to be an all or nothing approach. There are things that you can do it. And also too, we still have to live life. We still have to incorporate culture food. So in that concept is if I include all of the nutrients that I'm supposed to have in a day, and she has a systematic way of doing that, then if you have a hamburger, it's not going to kill you. because you have all of the nutrients that you need for your body to function properly. And the way that she has it broken down by disease, like if this runs in your family, if you've been diagnosed with this particular disease, these are the nutrients that you need most. Like a lot of times with autoimmune disease, they say that we need vitamin D. These are the foods that you need to incorporate. And each food has a score. It's not about tracking calories. It's not about calories at all. It's about how do we get the nutrients from the food that we need to prevent or mitigate flares, and to prevent or mitigate additional diseases from happening in our body because we're not feeding it the proper nutrients.
That's wonderful. And what I want to say about that is that we know that many people try to do some of these diets and they get so frustrated sometimes that they give up in it entirely. Or they tried something and it didn't work for them and they went back. I always say to their Twinkies and their Ho-Hos. But we would like that if there's something out there that simplifies it and brings that practicality, that maybe this is a great stepping stone for some people. And maybe from there they can look into other things. And like you said, there is also a reality that not everybody can, get some of those organic foods. And I think that you're allowing other people to have an open mind to some of the suggestions that is better than not trying it at all.
Absolutely.
So there's a common sense and a practicality. I think I keep coming up with that word because it seems to fit best into that. And you have on your website it's your resource library, and you have in that those areas that people can click on and learn in depth about, correct?
Absolutely. And even on the Mighty Network, if you're in that group, we have an entire section. So you talked about the round table. You also see Mickey Trescott. Mickey Trescott is kind of taking over the helm for Dr. Sarah Ballantyne when it comes to autoimmune protocol. So now you mentioned it being difficult. We have a core and we have a modified, which simplifies the process. She in our group posts recipes, tips and tricks on how to make the process easier. She even has a new book coming out, and I believe it's in May, and we'll have a group on how to simplify the process. It's not supposed to be stressful. The issue is that there are a lot of people out online who are promoting the autoimmune protocol, with a narrow focus and not with the intent of the original people who started the autoimmune protocol. It's not supposed to be, this is a diet that I stick to for the rest of my life. I mentioned tool. For me, it was a tool that I used. I was much bigger than this, like much bigger. But after I took the course and became certified and implemented myself, it changed my life. I eat what I want now, but I know what triggers me.
Yes.
I know how much, I know how little. I got my body back to a baseline to where if I eat something, I know immediately what it was and how it impacts my body. But also not just that, how to put systems in place to reverse it so it doesn't go further.
Absolutely.
Because you're gonna have flares from food, you're gonna have flares from stress. Life is life, and sometimes life just, as they say, be life. And you can have a flare from too much trauma you see on the news, which
We talk about a lot of this stress is causing
There's things that we can't get, but if we have the tools, especially sometimes the mental is worse than the physical when it comes to these diseases. I know it was for me because again, as I'm learning, as I'm going through this process, I get one, I think I'm getting better, then I get another one. I have that one, I do the work, then I get another one. I'm like, when is this ever going to stop?
Absolutely.
And then I have to come to reality, okay, it may not ever stop. I think 2023, I was getting the butterfly rash. I still get that. The people I work here with lupus, at the Lupus Foundation, like Jamie, I think you have lupus, and lupus is in my family. My mind now is better prepared for that, but a couple of years ago it wasn't because I was just trying to figure out life and how to better manage it. The more tools that I have, the more resources that I have, your resource library that you're building, it gives me back a sense of control over what I can do, and that for me takes some of the mental load off, some of the depression off, some of the anxiety off, which is only going to make the flares worse. So anything we can do to do that, to make it mentally, I guess more manageable, is what I'm also trying to provide through the resources that we provide.
Yeah, it's beautiful. It comes down to I always say being informed and being educated is key for survival. This is how you live long term with a chronic illness, and it's all these different factors of how to live with a chronic illness, and the triggers and the overlaps and the different symptoms, and trying to find what you can do besides with your healthcare providers to live that best life, and being informed, so you make informed decisions for yourself. And for
Absolutely.
everybody that looks a little bit different, so giving people this opportunity to learn that and look at the different perspectives helps people be successful in living long term with chronic illness. So I applaud that. I think it's beautiful. I have so many different things that I want to ask, but I know we're going to run out of time. But I think we kind of covered it. So I'm gonna. Alejandra was looking at a couple things that she wanted to ask you about. So I'm gonna let her ask you those questions, Jamie.
Mhm.
Thank you, Jamie, for sharing everything. I agree with everything you're saying, especially coming from being raised by a single mom and getting all the benefits and even the information. I'm Hispanic, so it's harder for us to get information. I was lucky enough that my primary doctor knew exactly what scleroderma was. And like you said, giving me the tools that I needed, even with food, because yeah, we can't afford to go get all organic food, but also, with the way that we grew up eating and now not being able to do it. But like you said, you can still do it once in a while. I agree with
Absolutely.
everything you're saying. And I know last week you had your Rock Wellness Weekend. Can you share more about it and how did it go?
Absolutely. It went wonderful, better than absolutely expected. So I'll start with the Saturday event, the Rock Expo. That's the third year that we have had that. It's more community facing and it stands for reaching our communities and kids. And it basically the concept was what I've been mentioning this entire time. People don't know that they're sick, especially here in Houston. We have the medical center. There is a health fair every weekend. But if you don't know that you're sick, why would you go to a health fair? So I'm making a party. We're rocking the block. So this particular year, we expanded that, line dancing down here, also rodeo season, where we're going to be performing at the rodeo, is up and popping. So you'll see hundreds, literally, of classes, a week. So we had 10 line dancers, come out to do a workshop. That's how I got them there. Then when they were there, then they were there. We had tons of resources from St. Joseph's. I don't know if you did, I didn't know this. St. Joseph's here in Houston is where Dr. Now does his surgeries. If you ever, I believe it's My 600 Pound Life. So he was here to
Oh,
do, they were here
okay.
doing wellness checks. We had student pharmacy organizations doing medication checks so you can bring your medication in to see if it's
Beautiful.
something that you should be on, check, cross check, blood pressure checks, blood sugar checks. We had MD Anderson, we had Disability Rights, we had Planned Parenthood, Autoimmune Association, not Autoimmune Association, Arthritis Foundation, Lupus Foundation. Myasthenia gravis was here this weekend and came down for the summit. So there was a plethora of information for them to see and pick up from based on what their needs were. And some of them may not even known that it was a need until they pulled up to the table.
Absolutely.
At the beginning, we had Acclinate, which is, well, now included, which is by Acclinate, who does clinical trials, go out into the community to provide resources to people of color. We did a screening of a documentary they did here in Fifth Ward. We were talking about environmental. There's a cancer cluster here in Fifth Ward that they did a documentary on because we've had entire streets of people pass away and get cancer because of the creosote the railroad train was dumping into the tracks, into the dirt out there. So we opened up with that after my welcome, and then after that they had the free will to participate in the line dancing. We had hundreds of people there, and then also access the other services that the providers in the community, our partners, provided. And we also had some breakout sessions as well. So that went wonderfully, again, community facing. But this year we added on Friday a summit, Rock Research Opportunity Collaboration and Knowledge. For me, again, this is not my background, nonprofit. What was interesting how it works, sometimes in silos in and of itself. Then also I know that funding is becoming an issue, like of resources,
Yes.
people is becoming an issue. But the demand and need is increasing every day, especially with the changes in insurance, the changes in benefits. So how do we as a public health community, community health workers, nonprofits, the city of Houston, which was a major part of it, the keynote speaker was the new head of the Houston Health Department. How do we better collaborate to come together to help the people that we need? What are we lacking? What are we missing? But also, I had a patient panel because it was important in both days to include the patient voice. Nothing for us without us. And so having all stakeholders in the room, and the patients that I had were advocates, strong advocates in and of themselves, who have their own nonprofits like myself and do the work. So imagine a panel full of me with different
Love it.
diseases, from
Love it.
Crohn's and colitis, lupus, myasthenia gravis, sharing their insight and perspective as a patient, but also as someone doing this work. It was extremely powerful. We had the keynote, 3 panels. After lunch, we had a collaborative session where we put on the rock wall, where do we see the need? What are we missing? How do you want to collaborate? What knowledge do we need? What are we doing with the research? And so I just, before this conversation, was able to synthesize all of that data. And in and of
Beautiful.
itself, that portion of it is amazing because I'm gonna be candid here. I have chronic illness. I'm tired a lot. If I get up out of my bed and do something, whether it be go to the gym and teach my fitness classes or have a summit, if I roll out of bed and put my bra on, I want it to be purposeful. And I wanted this not just to be a summit where we go talk and leave and then nothing is done, so people can say, oh, I had 1,500, not 1,500, or 100 people at a summit. We talked about some things but never did anything about it. So my goal now, the real work comes in, is where we're doing something about it. So I hope to put that report out soon, and start collaborating with some of the other organizations there in the cities to see how we can best work together to move our missions forward.
I love that. And was there any like impactful moment where somebody came up to you and said something that you left with from your summit? I'm sure you're running around like a chicken with your head cut off the whole time, because when we do even just a patient education day, I feel that way. But was there a moment, and I'm sure there was many, that resonated with you? Anything that you can think of that resonated with you?
There were many, but one, and I was going to post this later, was we had the people put the sticky notes on the wall, and one of the sticky notes said, "Now," he's like, I believe now that the years of pain that I have been going through all this time and didn't know, now I believe it is lupus." And so for me, I want to get emotional,
Yeah,
like, right? I
absolutely.
understand the turmoil that you go through when you're trying to go to the doctor and you can't figure out what's wrong, like years. Right. And
Yes.
so just that one person, and that's not the only story, but that again emphasizes the importance of sharing our stories,
Right.
and letting people know. And I believe that was from, we had 2 panels, our autoimmune panel, where we had the executive director from the Lupus Foundation, Arthritis Foundation, Myasthenia Gravis Holistic Society, and the VP of MS. So we had that panel, but the patient panel was one of the most powerful panels. Hearing those stories, and at the end, there wasn't a dry eye because we all understood on a different level than most the experience of living with a chronic illness through before you were diagnosed, getting a diagnosis, and even afterwards. So I think again, continuing to share those stories is how we're going to be moving forward, because people just don't know and they need to be able to hear those stories so they can get the help that they need as well.
Yes. Beautifully, beautifully stated. Beautifully. Alejandra, any other questions you have for Jamie?
Yes, well, going back to the Rock Wellness Weekend, I would love to be there next year if it's possible. I think we need a scleroderma representation there and get to, I know for me when I was diagnosed with scleroderma, I had no idea what it was. No one in my family knew what it was. And like you, I had symptoms growing up that became normal to me. normal. I thought, always having dry skin is because you're under the sun, pain because you growing pains, what they called it. Now that I
Yeah,
was diagnosed, I know it wasn't growing pains. And when I
mhm,
hear a doctor tell a parent, oh, it's growing pains, I go, no, I think you need to check that because that's what I was told growing up, and it was
mhm.
not growing pain. So next year, if it's possible, I would like to
Absolutely.
be there. And I think the foundation will love to be there as well. Just, trying to see if we can help with other patients that have symptoms related to scleroderma.
Yes, and
Absolutely.
yeah, and on top of that, encouraging the scleroderma community in your area, and many will come to your summit and realize that there's a lot of things that you have in your exhibitors, your vendors that can be very helpful on top of just having somebody like us there. I wish that you were global, but I'll take what we can get for now. Do you think at some point that this would be something that you would expand into other states? Has this been asked before?
It was on the it was on my rock wall with the sticky notes. So yeah, it was a powerful summit. So now that we want to do it, I've gotten requests. I'll just put it like that to do it at several different places. So it is something that we're looking into.
Yeah, but in the meantime, we know that just because you're in Texas doesn't mean that your resources don't help us in other states. We can all utilize your resources regardless of the state that we're in, right?
Absolutely. And that's how we started. I didn't mention earlier, we're a national organization. That's how we started online because we're connected with the AIP Summit and Autoimmune Wellness, who have autoimmune certified coaches across the US and across the world. I've had, on the other side of it, I'm also a certified coach. So I've had clients in Australia. I've partnered with AIP coaches in France and in the UK to do in-person retreats, not associated with the nonprofit, but my point is our span is global. We do have global reach. We have global reach in our online community. There's people not just from the United States all over, but all over the world in our network.
Oh, that's wonderful. This sort of segues into the last question that Alejandra has for you.
What does the future look for IAP BIPOC Network?
Um, I guess what we just stated, what we just stated there, expanding nationally, but I do want to take it slow because again, someone was mentioning, oh, we can take this. We have a big convention center here, right? But but again, if I wanted to have it in the convention center, or or if I thought that was the focus, there's people doing that already. That's not in walking distance. For me, it's important to keep it where the people are,
I like that.
and make it scalable to where we can duplicate it easily, city to city by partnering with cities. We partnered with the Houston Health Department. We were able to use their facilities. They have community centers all over in those under-resourced areas, which makes it easier for us to be able to pop in, pop out because we have that partnership. So being able to scale and do it in a way that we're not so much focus on growth. It sounds bad. I
No, it
really
doesn't.
wanted to have an impact more than growth, if that makes any sense.
I know what you're trying to say. It
Right?
makes total sense, actually, what you're trying to say. Sometimes expansion isn't always successful when you've lost sort of the sight of the core value because it's
Absolutely.
gotten so big, and sometimes we don't have the bandwidth also for some of that
Absolutely.
expansion. So I appreciate and respect that what you're trying to say is I would love to see this, expand, but at a level that we don't lose the core values of who we are as an organization and some of the things that you said, like being in walking distance for a lot of people. We did a patient education day in Northern California, and we expanded into the area after only really being in Southern California, and it was lovely. And people were coming sometimes up to 3 hours to get to my patient education day. And so, and while I'm glad that we had that opportunity, not everybody can do that. So I applaud your humble answer to that question, and it makes total sense. And we've learned, I think, through the pandemic, collaborations don't have to be city to city and state to state. We can find ways to work together in the best interest of the families that we serve. It's one of my favorite sayings. How can we partner and collaborate in the best interest of the families that we serve? And you're
Absolutely.
definitely one of them that I think is doing an outstanding job, Jamie. And
Thank you.
I always say that I don't wish scleroderma on anybody, but if not for it, I wouldn't meet some of the most amazing people that have graced my life and made it better. And Jamie, I don't think I would have ever come across your page or connected with you if not for it also. So I'm so thankful and grateful that we had this opportunity to meet you and talk with you and get the word out about the beautiful work that you're doing. You are making a difference, and I know that there's families that we serve that are really going to appreciate this opportunity to get to know more about what you're doing and benefit from what you're bringing to the table. So we're proud of the work that you're doing, and I can't tell you how much I appreciate you today, and thank you for your beautiful work that you're doing.
Thank you so much. I appreciate that.
And so when we do this recording, we want to make sure everybody knows how to reach you. So do you have social media pages? What's the best way to reach you, Jamie? And
Absolutely, I do. So the best way to reach or our website is AIPBIPOC.org, AIPBIPOC.org. And when you go there, if you scroll down, you'll see programs. The second one after Roundtable is how to connect with our online community. And then on all social media platforms, you can find us at AIP BIPOC. And our email address is info@AIPBIPOC.org.
And that's how I got a hold of you. And I was like, let's see if she's going to answer me. And you did.
I
And I was
did.
like, she did. She answered me, because you never know. Sometimes what you're going to get, you sort of throw it out there and you wait to hear from somebody. And sometimes you never hear back from people. But
Absolutely.
I heard back from you, and you're very authentic. And we greatly appreciate you. And we'll make sure that your contact information is included in our recording of your podcast. And so again, thank you, thank you, thank you. And I hope that we have an opportunity to work together, and just congratulations for all the beautiful work that you're doing.
Thank you so much. I appreciate that.
Thank you.